Aloha, Hawaii. It's time for the Vein Clinics of Hawaii radio show. Their team's approach to diagnosing problems and developing solutions and treatment plans are beyond compare. So let's get started with your host of the show, Mike Buck, and medical director, Dr. Randall Juliff of the Vein Clinics of Hawaii.
Far and wide and far-reaching, and you can get a hold of us at veinclinicsofhawaii.com, and we'll give you a phone number and all of that a little bit later on. You know, what we do on this show, we try to sort of educate you on the latest in venous technologies, venous disease, and there's all kinds of other things happening at the Vein Clinics, and we'll tell you about them a little later on, time permitting as well. But one of the things that we've circled back on a lot is the way things are now diagnosed and triaged and looked at. And you've often heard us talk about this thing called ultrasound. And we've never really had a chance to really spend a little time on what this thing is and how it is so beneficial in your and other medical trades, right? So here we are in, let's pretend that this is Ultrasound 101. What is this thing anyway?
Well, ultrasound machine is something that gives us information, I guess, about the body in one way or another. And it's able to look inside the body in a way that has very little risk. It's not like regular X-rays.
Yeah, let's make sure that people know that you couldn't lay there and have X-rays done on you for 30 minutes.
Right.
You know?
Yeah. In many of our exams do easily last 30 minutes or more when we're looking at all the veins and arteries and whatever in the legs and other places. But yeah, there's essentially no risk whatsoever, and it gives us a tremendous amount of information. And then in addition, the ultrasound machine has simplified those endeavors tremendously. I mean, in the old days, there were other machines. You know, there's something called plethysmography that relied on, containers and pressure and volumes and all this sort of stuff. And it was not as accurate and very inconvenient to do. And ultrasound has essentially gotten rid of all of that.
Has that replaced the let me shoot this dye in your foot and see it go up your leg?
It hasn't replaced it completely, no. But yes, it has. Well, let me restate. It has eliminated a lot of venography. Angiography that was being done before because we had to. We don't have to because of ultrasound now. Do we still do venograms? Yeah, definitely all the time. Okay,
and we'll talk about that. But I really want to get into a little bit more of the history of it, because now, as you see, it's in every ER. It's everywhere. And at first, maybe you were telling me off the air to begin with that it was actually developed in obstetrics and OBGYNs.
Right.
And this is, I guess, to see the baby.
Yeah.
But like you
yes.
see, and things.
Right. Yeah, I think initially it had a lot to do with seeing the baby and all that sort of thing. But yeah, it was the mid '50s. So ultrasound's been around for probably longer than most people think. It from a clinical standpoint, again, as you mentioned, it was mid '50s, and it started mainly in an obstetric sort of scenario. However, it goes way back. I mean, the first person to really recognize that sound waves, which is basically what this is, sound waves can be utilized to give you information, was a guy named Lazzaro Spallanzani. I think he was Italian.
I think I had some of his spaghetti sauce. Yeah,
very good spaghetti.
Yeah,
and this was back in the 1790s, so this is a long time ago. That he discovered that bats, the thing we know about bats is that they live in the dark and they don't
knock into the walls.
Yeah, they don't have, and they don't do that. We don't have to see, or they can't see. They rely on sound waves to identify objects that are around them, and however they do it. I mean, it's it's been a tremendous evolutionary step for them. But this guy back in the late 1700s was able to figure out that bats were using sound waves to detect objects. And basically that's all we do right now is use sound. The ultrasound machine is to use sound waves to identify objects and moving things like blood and heart valves and all that sort of thing.
And by the way, a little later on, I'll share some of my own experiences with this, because as a patient, I'm fascinated because you can actually see your stuff. And,
Yes.
you know, it's like now if you go to a dental office or any doctor's office for x-rays, the x-ray is up on the screen. You don't have to send it over there and dip it in the thing and do all of that stuff. You can see it right away. But this is fascinating because you can watch it.
Yeah.
And I guess, and you know, before, a little later on, we're going to meet our special guest who actually performs the procedure in your office. But I would imagine just like there are all kinds of drivers, and there's some that do it really well, and there's some that I don't care how good the machine is, you know.
And that's one of the very crucial things about ultrasound. It's very operator dependent.
Mm-hmm.
You know, a lot of people can take a chest X-ray. You know, a lot of people can do a chest X-ray because it's like, you know, propping the patient up and taking a picture. But ultrasound is not like that. It really is dependent on the person doing it.
I have a bunch of questions that we're going to get into a little later on that because I've really enjoyed learning about me through that, especially when you bear down and then they release it and you can see the and all of that stuff.
Yeah,
pretty exciting.
See it and hear it.
Are
too.
those, you know, and we'll ask this, we'll get into this a little later. All those little noises that you hear, are they for the operator and the patients just to have something to hear, or do they actually, is that sound actually going on in there?
Well, that sound isn't going on in there, but the ultrasound machine is again picking up motion.
Yeah.
And that motion then is converted to sound by the ultrasound machine.
It's like, but if a tree falls down in the desert and there's nobody there to hear it.
Yeah, right.
Okay. But I think maybe just getting into how this has adapted into a lot of other things.
Yeah.
I mean, right now you get it, like I said, don't they immediately have it in an emergency room?
Oh,
Almost
yeah.
always. You know?
Yeah, definitely.
So what made it change? And I'm guessing, again, if you go into the old garage of old ultrasound things, they're going to be things big as a room.
Right.
You know?
Yeah, exactly.
Not the little things. Right?
Not only size, but the quality of the the image that we get.
Yeah.
I mean, with time, even now, as time goes by, you know, machines are being improved. You know, they're like TVs.
Sure.
You know.
Yeah.
Unfortunately, they're a little more costly than a TV. But yeah, the technology is being developed and honed, you know, more and more with each year that goes by. But yeah, you know, we started out in the obstetrics kind of field. Then probably the next step that it took, and this was a little later, more during the 1970s, that ultrasound started to be used for vascular issues, you know, of the sort that we take care of. And that was developed by a British guy, I think, originally. But you know, as time went on, it was used more and more. And again, it was used on a greater scale as the information that we were getting from it was being improved with the technology, et cetera. So I think the next level that it went to was heart, because there was needed a way to look at the heart without sticking a catheter in somebody's leg,
especially a sick one, right?
Shooting dye and all that sort of stuff. So ultrasound was a perfect answer for that, and again, it gives us such a crisp, visual image of what the heart is doing, and we can define pathology just from looking at the ultrasound.
Are there some things that you see in your venous practice that you would refer it somewhere else? In other words, your operator just finds something and says, "This doesn't look good. It's not part of us, but this needs to get looked at."
Oh yeah. All the time.
Yeah, I guess
all the time.
Yeah, I'm dying to get into that part of it. So it, like everything else, it's osmosed and it's changed and it's gotten more modern, probably more effective. Probably you said they're expensive. I remember when big screen televisions, unless you owned your own business, you couldn't do one. Now for $5,000 you can get a whole theater system.
Oh Lord, yes. Yeah.
But I'm not sure that is the use way more widespread than it used to be. I mean, I'm guessing already that there are even sporting events where there's ultrasound available.
Sporting events?
Yeah, football games.
That's a good question.
Yeah, basketball locker rooms.
I don't know about. But it's used in in water and in boats a lot. You as a fisherman, don't you use an ultrasound machine to see where the fish are?
A fish finder is very much a sonic.
That's ultrasound.
And interesting enough you say that. The guys that I fish with are kind of geezers. So we gifted the boat at Christmas time with the defibrillator. And everybody knows how to use it because you're fishing 40 or 50 miles out.
Yeah.
But the same thing is true. Now there's the GPS, which is going to get you right back to where you go. Mm-hmm. But before you soak your lines, you can stick that probe down there and say, there's no fish here right now.
Right.
Because you can see them.
And that is the exact, the mechanism that's being used in that situation is the exact mechanism that is being used in a medical scenario with, an ultrasound, a clinical ultrasound machine. Sound waves. And maybe we can ask Michael a little bit more about this when we start talking about how the ultrasound works. But it's based on emitting sound waves. Those sound waves bounce off of whatever object, and then it comes back, and that's what you're seeing in your boat. Those sound waves.
But you got to know what to look for. I mean, for instance, if you think you're treasure hunting, there's a big difference between a gold bar and a rock. You know, so you have to really be able to. And I think we were talking about this a while ago, long before we decided to have somebody in and really explain it. That it is a very crucial part of your practice. And this is a very integral tool key that you probably couldn't do a job these days without it.
For our practice specifically, it hinges tremendously on our ability to, us having a high quality ultrasound person to do the examinations and the information that it gives us. Because, basically we evaluate everybody with ultrasound and we base most of our treatment plan, et cetera, on what those findings are.
And so in your clinics, it was around in the 80s. So it really is in the big picture, just a blink in being used. So I'm wondering if, now with the methods you have for treating the disease must be also because you can see it better than you used to see it. You're not guessing as much. You can see this and insert that laser or that wire into a very, very small place.
That's true. And in addition, it helps us do the procedures. Not only is it giving us information about the pathology that the patient has, but we use the ultrasound machine extensively when we're doing the procedures.
Yeah, that was my big question. Somebody else asked me at the store the other day, because they've been hearing us talking about this, and said, "Is it used during the surgery?" And I said, "I don't know how it couldn't be."
Yes.
Because it's the eye, right?
Right. Ultrasound has allowed us to do the very minimally invasive kind of procedures that we do, as opposed to 20 years ago when we were having to take people to the operating room and do surgical vein stripping and all that sort of thing.
Okay, so bounce forward a little bit. And when Vein Clinics of Hawaii first started on the Big Island, and then Maui and Kauai, and now here on Oahu, and you've done practice in a lot of different places, so that must mean that it's contingent upon you having the people to be able to do this, to be able to expand, to be able to see a lot of patients.
Yes. Yeah.
Okay, so what were the first of all, before we meet Michael, what were the prerequisites? What made you decide, all right, in order to do this properly and do it correctly, not just correctly, but to do it expeditiously and keep the costs where they need to be and the insurance where they need to be? Let's talk about that. Insurance is a big deal. We talk about maybe, some of what you do is cosmetic and elective surgery, but does the ultrasound determine what's no longer cosmetic and what's a little bit more than that?
Yeah, I think the ultrasound machine will tell us which patients, have a vein problem, venous disease, which of them do not, and then obviously that's going to, guide us in how we're going to treat those patients. Almost everybody that comes in with, for instance, just spider veins, typically most of those people, if they have symptoms otherwise, we will do an ultrasound.
Yeah. Otherwise, wouldn't it be that it has to be more symptomatic to determine, do you really need one? I mean, you can see spider veins, right?
Yeah. If somebody comes in and has spider veins and they just have no symptoms whatsoever, then typically we don't do much of anything with them. But if they come in, they have spider veins, and they may have some, vague symptoms or symptoms that aren't, completely consistent with venous insufficiency, we will do an ultrasound to rule it out most of the time, make sure that they don't have it.
Yeah, that was the other part of it, the diagnostics. It sounds like this is also a very, very valuable device to rule things out. Not in, but out.
Exactly. Yeah, a big part of medicine is like that.
Yeah.
So the ultrasound machine easily rules out a patient that does not have venous insufficiency, and so then we treat them as a cosmetic issue.
Do you still need X-rays sometimes?
We we do. We do. We don't do X-rays in our office the way we do ultrasound, but not uncommonly we do send patients to radiology places and do CAT scans.
Sure.
And
the reason why I bring that up, gang, is because as you've learned during the program, and by the way, you can get to veinclinicsofhawaii.com and see more of this, but one of the things that I think is fascinating that almost all of the stuff, if not all of the stuff done at vein clinics, it's you walk in and you walk out. I mean, you don't have I've been there. There's no beds. There's no bedrooms, I should say.
No.
You're not planning on bringing some food and camping out for a couple of days. You're in and out.
Yes.
And I would imagine that let's talk about how much can be done when somebody's there. We haven't talked about that for a while. Let's just briefly say, I want to know how the ultrasound relates into having you be able to do more work while you're there.
Yeah. Well, it does. There's no question about it. And the fact that we have, somebody with the expertise that Michael has, and the capabilities of doing those kind of studies, we've become much more efficient. I mean, the patient can come in, we can see them, we can talk to them, we can do our initial consultation, et cetera, and virtually on the same day we can do an ultrasound and tell that patient what is really going on with them.
Yeah, and I think therefore they're where bedside manner comes in. Because, I mean, you got a machine and now you're starting to stick it on me and take a look at stuff. I want to know who's doing this. Now, we've talked behind his back for several minutes now. He's actually in the studio. We're not making this person up. Michael Stadlberger is here, and he is a doctor of ultrasound. First of all, hi. Thanks for sitting here and being a patient guy, because we've been talking about you behind your back here.
Hey, Mike, it's a pleasure to be here. Thank you.
What sort of certification or what sort of credentials does one need to be a good ultrasound person?
Well, most of us in the field, we go to school after college. Typically takes about 2 years, and it's a diagnostic imaging school, diagnostic sonographic imaging school, where we learn the basics of like the physics of the ultrasound machine, and then we also learn about the different areas that we perform ultrasounds on, and then we typically gravitate toward one specific field where we will specialize. I gravitated toward the vascular ultrasound and cardiac ultrasound.
The reason I ask the question is, and I'm sure you run into people from when you're a little kid or in high school, and you're doing what? I mean, what got you interested? What said, hey, this is something that I like, I want to take a look at?
Yeah, that is funny, because most of the people that I speak to about my job, like if somebody asks me what I do, usually they have no idea what I'm talking about. I mean, people think that when somebody does ultrasound that they're going in and they're looking at babies all day, and that's just it. But that's just very, very inaccurate. I'm sorry.
I think the first sort of fork in the road, when you're learning how to do ultrasound, and you sort of learn how to do ultrasound in a general sort of fashion. You learn how to look at a gallbladder,
sure,
or a kidney, or doing breast exams, etc. So they learn all of that, and probably then the first fork in the road is: are you going to do general ultrasound, or are you going to do vascular? Am I correct there, Michael?
Yeah. It's pretty accurate.
But what I'm saying, the original interest was just in the concept of ultrasound.
Well, I had a friend who had a sister who was in ultrasound, and
okay.
I remember her talking about it, and I just thought it was very fascinating. And I always wanted to be a part of the medical field, had a great interest in it growing up, and just kind of found a nice niche in the field.
Yeah, and I would imagine that when you first get your ticket or you get your certificate or you've got your badge. Getting a job and keeping one and learning must be a big part. What brought you to Hawaii?
Well, I mean,
besides Hawaii.
Yeah, well, pretty much Hawaii brought me to Hawaii. I've been coming here since I was a kid, and I fell in love with this place. I'm from Los Angeles and kind of wanted a change of lifestyle and came out here. Coincidentally, as I started looking for work in Hawaii, Dr. Juliff and his practice were looking for somebody like me, a vascular technologist with experience in venous insufficiency, and it was just
we kind of skipped over that, Michael. Excuse me. We kind of skipped over it. So you started, and then as you, even though you admired your friend's sister or whatever it was, you still had the light on. This is the part that I want to do. You know what I mean? What area you specialize in? How long before you decided exactly what you wanted to do? Were you studying it already? Well, like Doc said, you're looking at the whole thing, right?
Yeah. We learn everything in school. We learn, about all the different organs that we can look at, the pelvic area, the small parts, the musculoskeletal ultrasounds that are out there. And then you kind of, like when you're in school, you kind of find your niche and you find what interests you the most. And that's kind of when you decide, like, okay, this is where I want to focus myself in the field. And then so I started doing that once I got out of the field. And it's challenging to get your first job.
I was going to say, who extended the opportunity for you to get your first job in the area that you wanted to work?
Well, I started working with a registry, and a registry is a company that employs ultrasound techs and just sends them basically where they're needed. So I was sent to a lot of different hospitals, at crazy hours in the middle of the night, working shifts where I was basically on call. Got a lot of experience that way, and that's how I was kind of introduced into the vein world. There was an office in Los Angeles who needed, a tech, but not full time. They needed me like 3-4 days a week, sometimes less. And I started working there. I stayed there I kept going back to that office because it was a good match for both of us. And I really kind of developed a passion for treating the venous insufficiency and just being a part of it. Not many people do these ultrasounds. So
and Doc, you've actually said this before. I don't want to make Mike feel that we're talking about him, but we kind of are, because you talk about your people are your practice.
Sure.
And and to do this, you have to be doggone certain that everybody is doing the job best qualified, for them to do that. So that, how did you find Michael, or how did you find each other?
Well, I think Michael touched on it. He was looking to come to Hawaii. He was working in Los Angeles. And we had an ad out there, I guess, right? Did you see an ad for a position? And it just so happened that we needed someone right around the time that he was looking. It was, a fortuitous set of events. But I wanted to touch on the fact that, there's that initial fork in the road. So did you ever work as just so, people out there
understand.
They may, there might be people out there thinking about going into ultrasound as a career, which is a good one. But how did you ever have a job outside of your education having to do with general ultrasound, abdominal, pelvic, etc., before you started doing vascular ultrasound?
Yeah, when I first started working in the hospitals through the registry, we did do everything, but vascular is where I wanted to focus my energy into. So I started requesting basically only send me to vascular places, and then eventually, after about a year or so, that's all I was doing.
Gotcha.
And then
you know what? There's another hat you need to put on. I want the listeners to understand. By the way, I keep telling you about veinclinicsofhawaii.com. Check that out, and check out a whole bunch of other things. But I'm guessing that as a professional, that you also would be wanting to make sure that whoever you are diagnosing for was going to perform the procedure and heal a person. Because, you're helping someone to identify. What I'm getting at here is that for those of you that are out there, I think Michael is the first person in a practice that you actually are doing something with other than just answering some questions, right?
Yeah, that's correct. The patients will come in. They'll always, they'll usually talk with the doctor first, and then if the doctor sees fit, then they'll order an ultrasound exam, and then I will perform the exam and kind of find where the issues, where the problems are, so I am one of the first steps in the process.
Yeah, I think that's really cool, and I guess you have to say, what about people that are apprehensive? I wasn't, because I was a big old football player. Yeah, whatever, But I know that some people, what is it? Are you going to poke me? Is it going to hurt? What's it going to be like? All that stuff.
Yeah, well, we start the exams off by kind of explaining what ultrasound is and explaining that it's non-invasive, that, we tell them that it's only going to take between 30 to 45 minutes or so, and
little cold, maybe.
Yeah, it's a little cold. Well, we're nice at Vein Clinics of Hawaii.
We
heat
warm our gel.
Yeah, we heat the gel up. Patients really do appreciate that.
So, the Michael at some point decided that he wanted to gravitate toward vascular ultrasound. And like I said, that's sort of the first divide. But then beyond that, then he started to be involved with vein offices and physicians doing vein procedures, and developed even a more specialized interest in venous ultrasound as opposed to general vascular ultrasound.
Yeah,
and I will
the
tell
difference
you,
is maybe you could explain a little bit. I mean, there's a lot of things going on in the vascular system besides just the veins.
Right. Yeah. Well, exactly.
Yeah.
Exactly. I mean, we
Arterials,
look at arteries all the time too, but the expertise required to do a high quality venous examination is much beyond, I will tell you frankly, than people who are doing just general vascular ultrasound. So it really requires somebody like Michael, who has a real specific interest in doing venous studies and wants to spend the time getting good at it, which he did.
That's the next level. I mean, was there anybody marking your progress besides yourself? I mean, every new call you get, if the guy calls you back, he was happy with what you did, or if you like the clinic, you're likely to do it. But what sort of confidence did you start gaining, saying, I'm glad I have zoned in on this particular phase of it, and I'm pretty good now?
Well, it was always the doctors who kind of assessed my
they evaluate.
They tell me how I'm doing. But when you start off doing the venous insufficiency exams, like Dr. Juleff said, I mean, it's very difficult. It's very challenging. There's a lot to it. You can't just kind of start doing it and be good at it right away. So, but I kind of caught on pretty quickly. I understood the venous system pretty well, and the doctors preferred to be working with me, so I started doing that primarily, the venous insufficiency exams, and then guiding during the ultrasound, during the venous ablations.
I want to make sure, let's do both sides of this for a minute. After the doctor determines that this patient will benefit from having ultrasound, we need to take a look. Now let's talk about in the actual procedure yourself, because, I mean, itself. When that's happening, you're also there at the doctor's side doing the ultrasound as he works.
Yes. Yeah, I do help. Dr. Juleff is also very good with ultrasound, so he does use the probe often while he's doing the ablation, but I'm always there helping out. And
and also not only helping out, but also just having additional insight.
Yeah, I was going to ask you about that. Every time you and I do a program, I learn that you are just as inquisitive as informed. So you must be able to bounce something off somebody that you trust and say, what do you think? Is this one of those?
Yeah, well, we go back and forth all the time.
I bet.
If there's something that I need a little more detail on with respect to the specific problem. I mean, we talked about a patient today. Michael has that additional insight into what's really going on with the patient, because he was the one looking at it, originally, and diagnosing the problems and making the drawings that we make and all that sort of thing.
Do you go sometimes, Michael? Let's say that I'm a patient, and I haven't had an ultrasound for 6 months, and I just want a tune-up, or the doc says, or get a letter from the clinic saying, Mike, we haven't seen you for a while, and we said you should come back in 6 months and take a little look. Can you go back to the work that you did 6 months ago and have that be valuable to you?
Oh yeah, absolutely. Yeah. It's
How does that work?
Well, it's very valuable. I mean, you look at the previous studies, and that kind of gives you an idea of where they were, and then you can look at what kind of symptoms they're having now, and use that as sort of a baseline. Yeah. Do the ultrasound, and things may have changed a little bit since the last ultrasound. In 6 months, a lot of things can happen. Usually it's pretty similar to the study that was done 6 months ago, but sometimes,
that's not. Isn't that where what Michael is talking about? I'm just guessing. Is like what we talked about a few programs ago. Is everything was fine until this guy got on an airplane, and then all of a sudden, his ultrasound from 6 months ago, he's a train wreck. There's something really going on in here that's really got to be taken a look at.
Yeah.
So having that, how is it stored? How are the ultrasounds stored?
Well, it's digital.
Yeah.
So it's like a computer stored in JPEG files.
So you can just crank it back up again. I'm fascinated.
Yeah, getting back to sort of the transitions from one ultrasound study to the next.
Yeah.
Part of the one of the aspects of venous disease is that unfortunately we never cure people of their venous insufficiency because usually it's a genetic problem. So very, very often, people are periodically having to come back. And we use the ultrasound studies as sort of a story of what has happened to this patient. And even if other vein clinics have done prior procedures, we can figure that out just by looking at the ultrasound.
Yeah, I'm glad you say that. We talked about that a little bit, and that's the free change of information nowadays. When I'm in Brussels and you're in Honolulu, we can discuss the patient by the chart that you made up, the 6 points and all that stuff.
Sure.
Same thing with an ultrasound that somebody took a year ago.
Yeah. Well, and that's important.
Yeah.
I mean, not only can we see what the patient has had done in the past, but we can say, gee, this is what that patient looked like 1 year ago, and now here we are today. And we can say, well, gee, they're doing okay. They haven't had much, and there's really nothing for us to do. Or we can say, gee, they've developed a lot more venous insufficiency that we need to probably evaluate further.
Okay, I have one. Listen, friends, if you're just joining us, Michael Stadlberger is a technician at Vein Clinics of Hawaii. He does the ultrasound test, and we've learned a little bit about his training, about the years that he spent in school. But and you can be really frank with us because I already know that Dr. Juliff's office is like right up there where they need to be. But I would imagine that you've been to some places where they said, okay, Michael, we got a job for you down here in Pasadena today. It's this, so, and you walk in there and you look at, this is a beach cruiser. This is not a 10-speed here. Let's talk about the change that you've seen and the equipment that you get to use.
Well, I've worked at a lot of different clinics and with a lot of different doctors who are performing these procedures, sometimes you walk into a clinic or, a doctor's office and you are just kind of shocked that...
I control my laughing.
Yeah.
I can imagine. Wait a minute. You want me to do what?
Yeah,
I'm just guessing.
And, it's an uncomfortable setting to be in. But, when you're there, I feel like, okay, at least I can help make this a better situation. Yeah. But I was pleasantly surprised when I came out here to Hawaii and started working with Vein Clinics of Hawaii. Like I said, I have worked with a lot of doctors doing this, and I think Vein Clinics of Hawaii has the best quality of work that I've seen in my history of doing this, and they get the best results that I've seen, and they do a real thorough job. So they start with the procedure, but they follow through and finish it up until the end of it. Where a lot of places will just do one procedure and just kind of like let it snowball down from there and not really treat anything afterwards.
I'm really glad that you brought that up because I've been actually hearing that more and more. And even though there are a lot of really cool things happening at vein clinics now that are fun things, they're cosmetic things, they're feel good, and they're self-esteem builders. The bottom line, Doc, is that you are a vascular surgeon, and that your calling is to help people have a better quality of life. Yeah. So that must be very gratifying when you have staff that say, "Well, I've worked in a couple of places, man. I'm glad I'm here. This is where I want to be."
Well, I'm glad that Michael said that, and he'll be getting a little bonus.
I was going to say a little bonus coming your way. You didn't see the envelope that Dr. Juliff just slid to him here.
Yeah, thanks, Dr. Juliff.
There's a right way and a wrong way to do things.
Sure.
And we try to adhere to doing things the right way. But it is tremendously satisfying to see patients come in and everybody's on board. Michael certainly is very intuitive and understanding of what needs to get done with our patients, and pretty much our whole staff is very, very good with respect to that. And it's nice for all of us to see patients come in and actually benefit from the expertise of all of our team.
What is it like, Michael, when you examine somebody in the initial stages and they're off to have a bunch of procedures done and they've done that, and then they're coming back in for a checkup? They must be among the first to share what they experienced between the procedure and now here they are back again. So that must be kind of fun where you can say, hey, what we did for this guy really helped because I'm looking at him now and he's in much better shape than he was the first time.
Oh, yeah, it happens all the time.
Yeah.
I mean, I really follow people through the entire journey of their treatment. So I see them before they've had treatment most oftentimes, and then I'm with them while they're having the treatment, and then I get to see them after the treatment, and then 3 months later, 6 months later, a year later, and I can see firsthand that we're really improving the quality of these people's lives.
Yeah, and basically what we're talking about is, and it's really interesting, a couple of you may have been with us when we've had different patients in, and we do that from time to time, and that is when they report that maybe they were there for discomfort or for swelling or for an ulcer, for whatever it is, but what they ended up getting out of it was a better quality of life. In other words, they can go to the beach again, or they can play a game of tennis, and they don't have to have somebody looking at their legs.
Yeah, I think that over the years, people haven't taken as serious as they should have the disease process of venous insufficiency. I mean, I think it was ignored for many, many years, and then it was treated just sort of half-heartedly and not followed up on properly, et cetera. But I think in recent years, especially since we've developed these minimally invasive kind of procedures, it really can. It lends itself to changing lives, people's lives completely, because the symptoms that people can have from venous insufficiency are tremendous.
Yeah, you know what? I think that's really important, because I know, Michael, that before a patient gets seen by the doctor or by you, that there's a questionnaire on a scale of 1 to 10. What's this and that? What are you feeling? You must be the one that also can differentiate between. Some people have a condition and it makes them itchy. Another person, it might make them hot or it might make them cold. It's the same problem. Are you somewhat intrigued or somewhat interested at the way people explain their level of discomfort or what the symptom is?
Yeah, absolutely. And venous insufficiency can cause, a wide range of different symptoms. And the way I hear patients describing them is generally pretty similar. What I enjoy seeing is I enjoy watching patients come in with a complaint. My leg is swelling, or I get these cramps in the middle of the night, or it just feels heavy toward the end of the day. They're tired, and then we go through the procedures, we treat them, and then afterwards they say, "Wow, like I cannot believe how good my legs feel now that I've had these treatments done." And a lot of times, what's funny is that some of these patients will have symptoms, and they'll live with symptoms that they didn't even know they had.
Isn't that amazing?
Yeah, they're so used to having, certain sensations.
My mom used to walk like I do, but what I'm more interested in also is that sometimes I would imagine that there is a lot of pain. I mean, some people get pain. Are they sometimes worried that the ultrasound equipment's going to hurt them?
Sometimes, not too often though. Yeah. I try to make things as easy as possible for them, and hopefully I do a good job at that.
When you gauge that, I mean, let's say you were a masseuse. Sometimes somebody's doing a nice little lomi on somebody's shoulder, somebody's in the shiatsu thing, Do you sometimes actually have to probe a little bit more to find something that's maybe deeper in there?
Yeah, sometimes there's certain areas in the leg that we do have to kind of push down on, that, and it's more uncomfortable for some patients than it is for other. Sometimes someone will kind of I
was going to say wince a little bit. Ouch!
But not too often. It's not too bad.
But Doc, I bet you that Michael or anybody else, if they'd have seen the equipment from day one. The patients, if you think you're complaining here, you should have been here 30 years ago when we were doing this.
Well, I mean, especially before we were using ultrasound, but even now, even over the past 20 years, I mean, 20 years ago we were getting these ultrasound machines, and they were a huge machine that, we rolled around on wheels. And, I mean, literally the ultrasound machine that Michael likes the most it's like a laptop. It's like a big laptop. It's portable, and it's,
Yeah, but Michael, what about the other thing? And Doc and I have talked about this, so I'm really glad that you're here, because I think that I'm most fascinated when I can see it, when it's me. And I'm imagining that every single patient, do they all like me? Do they want to see it?
Oh, absolutely.
Let me see that thing, man. You're looking at the screen. I want to see it.
Yeah, absolutely. And I share it with everybody. I try to explain what we're looking at, and I try to let them see the venous insufficiency that they have, so they can understand what's going on in their leg. And I'm always happy to answer questions.
Yeah, because most people have no idea what venous insufficiency is all about. I mean, if they have varicose veins, they know they've got a varicose vein, but they have no idea as to why they have it. And when they come in, we're trying to explain those types of things to them, and they get some of it they don't get. But I think when they're then with Michael, and he's he's showing them what's happening on the screen, it all kind of comes together, and that's when they really begin to understand what's going on.
Yeah, and I'm also thinking that's when the treatment plan comes out. When you've taken a look at and evaluated somebody, okay, what is the most urgent? What do you got to do now? What are you going to do later? And I guess that's part of the plan. But I think that we shouldn't skip over something else. Oh, let me remind you all, that Dr. Randall Juleff is the medical director of Vein Clinics of Hawaii. Michael Stadlberger is the ultrasound technician. We're talking in pretty happy times, but I do know that there's sometimes when somebody comes in that's referred by another doctor that comes in because they've had an episode, that some of the stuff you do is pretty tough. You must see some very, very, alarming situations going on with people that, thank goodness we're going to test them because this is not good.
Oh, absolutely, yeah. I mean, ultrasound is a great way of catching serious problems like right then and there. It's it's very easy to do. We can determine whether or not a patient has a blood clot or something going on in the arterial system, and oftentimes they'll come in with problems, and if we didn't have ultrasound available, then we might miss a whole lot of important things.
Yeah, that's a big thing, Doc.
Yeah, we'll miss them or even delay the diagnosis of. If we didn't have our ability to do ultrasound right then and there, then it's we have to send a patient to somewhere else, and things get delayed, and it's several days, and they can run into major problems if it's not addressed immediately.
Well, we talk a lot, folks, about traveling, and as we get older and we got that bucket list, we also have risk, and we're going to go and see the wall in Israel from Honolulu. You're going to be in a lot of planes in a long time. Let's talk about the other side. Let's talk about people who travel a long distance to come here, and they get a DVT while they're in Hawaii. Mm-hmm. And thank goodness that there's practitioners and answers here. Does sometimes that happen to you get an emergency call?
Yeah. Periodically, we have people come in with sudden symptoms, and they either track us down, or there are people who have gone to a ready med clinic kind of thing, or ER, and they come over. Periodically we will diagnose somebody with an acute DVT and then treat them, and things are okay.
What was so far, and I know that many might think, well, it's not just another day at the office, right? You wouldn't like doing what you're doing if there weren't challenges and new things to see all the time. But how did you feel when you first started seeing, say something like I had this horrific thing that we talk about, I'm happy to talk about, had this horrific ulcer, and every now and again you must have to do ultrasound around something that's like that. Does it sometimes amaze you that some people will have that going on for such a long time and go get it treated?
Oh, yeah. People learn to live with some of their symptoms, and ulcers being one of them. And it is pretty shocking sometimes that people just kind of walk around with an ulcer for months
the
at a
ultrasound, Doc, valuable for treating the areas around an ulcer?
Oh, yeah, absolutely, because... and we've talked about this before. Usually, when somebody has an ulcer, they have reflux in something that we call a perforator vein. We've talked about that. That's a little one that goes sideways, right? Yeah, right. Goes from one system to the next. And we can see that immediately with an ultrasound. Yeah. And then we also use the ultrasound to help us guide our procedures to fix that sort of thing.
When you're looking at, because we've often said on the program, we tell people about all these things. We talk about the valves a lot. So a lot of what you do is working right around where there might be a valve that's a problem valve? Yeah,
absolutely. Yeah. And we can see a lot of times exactly which valves are refluxing, which ones are incompetent. And which ones are causing the issues.
The reason why I asked that is, remember, Doc, we talked a while ago about it's rare, but it does happen that somebody has one leg that has either no or very few valves, and one leg that's totally different. That the inside of my legs may not be the same.
No. Now, it would be rare for one leg to have absolutely no valves and the other one to be completely normal. That would be a little unusual. And there is a situation of congenital absence there can be of valves. That's pretty rare. Luckily, we don't see that very often.
The reason I brought it up is because, and another thing you said, Michael, and I think this would be really key, because one of my symptoms back in the day when I was being treated was swelling, and sometimes you're so swollen that your leg doesn't even look like it's supposed to look. So that must be not too untypical. I mean, you must see this quite a bit.
Yeah, swelling would have to be one of the most common symptoms that we see.
And swelling can interfere with our ability to get
That's
a good
my question.
ultrasound.
My question is, if somebody comes in and they're all swollen up, in order to do a good ultrasound, what do you have to do to stabilize that person so you can look inside their leg?
Yeah, and sometimes we have to do various compression kind of devices to get rid of some amount of that swelling so that we can get a good study.
Because what I want to do is I want people to understand that this ultrasound equipment is not going to drag it out when you're in there to have a couple of unsightly, what you think are unsightly spider veins dealt with, right?
No.
I mean, so what is the first? And by the way, I have these spider veins, but I don't have any symptoms. But shouldn't I still find out what's going on inside my leg once I'm going to get rid of the spider veins? Shouldn't I have an ultrasound to see what's in there?
Yeah, well, typically, if somebody comes in and they are concerned mostly about spider veins, from a cosmetic issue, and if they don't have any symptoms whatsoever, then no, we wouldn't necessarily go looking for venous insufficiency, because typically we don't treat venous insufficiency until it is symptomatic.
Yeah, and by the way, we've explained this before. If you have spider veins, it does not necessarily mean that you're going to have big problems inside in your vascular system. Yeah.
But on the other hand, there are plenty of people out there who have just spider veins superficially that have a tremendous amount of venous insufficiency.
That they can't see.
That they cannot see until they come in and Michael shows them on the ultrasound.
I'm not happy about that day, but I think that the other side of it is. And I don't know who actually gets to explain to me the patient, but you've taken the good look at me. I've been on the table for 45 minutes, and you know what's going on with me. You already know. Do some of them, are they trying to pry the information out of you on the spot? Oh, what's going on here, man? What's going to happen to me?
Oh yeah, every time. Right? Yeah, it's like 90% of the time.
I'd give you money. Here's $5. What can you tell me here?
Yeah.
Doc, let's talk about that, because we often talk about people, and we do have a laugh, and we try to have fun on the show, but there's a lot of people that are sitting out there that are teeter-tottering back and forth to decide whether they want to get, examined, whether they want to see if there's light at the end of their tunnel, of their system. Talk about how that becomes very important, the relationship between staff and the patient, so that the patient feels that they're in a good place.
Yeah. That's a very important point, no question about it. With respect to symptoms, people who might be out there and they're teetering on whether they should look into something or not, you have to remember that, and we've touched on it already, but the symptoms of venous insufficiency come on over such a long period of time, typically, and so slowly that it's, we see a lot of people who ignore their symptoms, but it kind of is easy to ignore symptoms because, again, they come on very slowly. It's not like overnight, boom, their legs are heavy, tired, fatigued, and swollen, So if you have, with respect to patients that are out there, if you have those kind of complaints, then you probably have to be a little open to the fact that, maybe there is something wrong, and you should have it looked at.
Yeah, Michael. Sometimes when you're doing your ultrasound, and I want to go along here about, we've explained to people what the gator leg part of their leg is, and this leathery skin. Is that also a problem for the ultrasound, or if somebody's skin is all leathered and hard and stiff? Do you have trouble getting through that?
Yeah, sometimes. Some certain skin conditions can make it a little bit more difficult to see underneath the skin with ultrasound. But typically we can do a pretty good job of working around it.
Yeah, this is pretty good, Doc. It gets down to the nuts and bolts of it. So obviously it's part of the process when somebody comes in for their initial consultation, from the time they get to ultrasound, after their talk with you, when do they get together with you and discuss it and then start talking about treatment?
Very shortly after. Typically we try to get people in for their initial evaluation, and we try to do as many of those patients immediately to get their ultrasound, and be able to tell them, what they have. And, the Michael's level of expertise is such that I don't mind if he tells people what they have. They ask him, and I'm sure he answers it. It's not like, gee, they have to wait to see me. But shortly thereafter, they'll be back. We'll go over the ultrasound in a little more detail and then start to talk about what the treatment will be. But that can happen over a relatively short period of time.
Yeah, because I think that everybody wants to know that. I mean, Michael, I'm sure that at your end of it, we're in such a, instant gratification society these days. We want stuff now. Okay. You see this on this thing? Are we gonna fix that this afternoon? What's going to happen here? So, does it sometime take a little consultation, saying, this is part of we're doing a workup here. We're not going to fix anything today right this minute. We're doing a workup, but sometimes I guess there would be a time when somebody would get treated right away. I guess, Doctor, more urgent it was.
Yeah, there are situations where we might do something urgently. Sure, especially. People who have spontaneous bleeding.
Sure.
We got to do something to make sure that doesn't happen again.
Lie down and elevate. Don't run. Yeah. If you run, it's going to bleed more. I know that part, right?
Exactly.
Yeah. But what do you think, Michael? I want to make sure before we run out of time in this episode of the program, how would you reach out to somebody that's listening and say, this is not an invasive procedure. This isn't going to hurt you. It's actually going to be kind of not an unpleasant experience.
Well, it's very common for people to come in and be a little bit nervous about having their veins treated. In fact, today we ran into a couple of situations like that. But I talked to them, and I just kind of explained to them that this is a very minimally invasive procedure, and I compare it to a trip to the dentist's office.
Yeah.
And
except for the little poke part that you get from the dentist, right?
Usually, the only little pokes that they hear or feel are just the anesthesia, and everybody pretty much walks out, a lot more confident in the procedures than when they came in.
I'm going to wonder, how come the stuff's cold? Can't we use warm stuff? Does it have to be cold?
Well, we mentioned before.
I'm talking about that's a little lubricant.
The gel. And we weren't kidding before when we said that we do warm the gel.
Yeah.
So there are actual gel warmers that you can get.
Thank goodness.
And we've 2 or 3.
I don't think I've not had that warm gel.
Yeah.
It's like when you're shaving. It'd be nice if you had a warm shaving.
Exactly.
But I still think that maybe most all of us, and this is kind of our parting shot. I'm going to thank my mom because it's in the family. I got but my mother also had vein stripping when I was a kid. It was a long time ago, and it was pretty invasive. I probably would have never sought treatment, thinking I never want to go through that. And I'm sure that you see now people that have come from a family that didn't have the modernization that you're now applying. So they come in there and they're a little bit nervous.
Yeah, absolutely. I mean, this is a genetic thing. So a lot of times their parents did have some veins stripped in the past, and they come in here kind of wondering what their experience is going to be like. But after finding out, that it's a very minimally invasive procedure, then usually they're much more comfortable with it.
Yeah, that's pretty good.
Yeah, and that's another important point, actually, because there are a fair number of patients who won't come in and be evaluated because they do.
They remember
their grandmother, and they don't know about how easy it can be today. So their fears should be relieved, and don't hesitate.
So if you had the big old thing that had like a baseball bat attached to it and all of that stuff, those days are gone. Yeah. It's a laptop. It's a little probe. Isn't it sort of like a magic pencil?
Well, a little bit different than a magic pencil, but it's a very small footprint the probes have now, and the machines themselves are about as big as a laptop.
Well, I want to thank you very much, Mike, for coming in and sharing your time with us. Hopefully we can do this again, and maybe one day we're going to actually have a patient that a lot of ultrasound was used on, and they can review that with us. Mike, thanks very much.
Yeah. Thank you. It's been a pleasure.
Yep. And Doc, we want to make sure that people find out the easiest way. They can go online to www. veinclinicsofhawaii.com. Yep. And we'll be back next time. Tell everybody about it. And the old gray mare ain't what she used to be. You know what I mean? So, all of that stuff that you might have thought about before, trust me, it is way, way different. We'll be back next time. In the meantime, it's the veinclinicsofhawaii.com. veinclinicsofhawaii.com. We'll see you on the other side, okay?
Well, that's our program for today, and we certainly hope you enjoyed meeting us. Please come back next week for our next episode. And in the meanwhile, to learn more, please visit our interactive website, VeinClinicsOfHawaii.com. That's VeinClinicsOfHawaii.com.